Hello, my name is Dr. Gerald Perrone from Facial Rejuvenation, Florida. I'm about to do a demonstration using Artefill facial filler, the only FDA-approved permanent filler, and I'm going to be using a new revolutionary technique using a Dermasculpt micro cannula. I hope you'll find this demonstration interesting and informative.
And tell me, when you look in the mirror, what are your main areas of concern?
Well, definitely around my lips, that they're shrinking as I'm getting older. I can see that, and the lines around my face that are getting more prevalent.
Okay, and I see, and that's a very common pattern. As we get older, we tend to lose volume. So what I see is a loss of volume right down here. We'll definitely do some lip augmentation, a little bit here in the nasolabial fold, or the smile line, and finally, you have a loss of volume up here. And to a lesser degree on that side, we'd be treating by filling in this area up here. We tend to get a lift, and it tends to make this line less noticeable. And we're going to do lip as well. The nice thing about today's treatment is that we're going to be using a Dermasculpt micro cannula. You've had injections before, and you know how painful it is around the mouth, and I think you'll find this much less painful today. It's a much safer technique, and I think it's going to really revolutionize facial fillers in general. We're going to be using Artefill today, really more of a hybrid product, because part of it will be reabsorbed, so there are a number of treatments that are required over time to get the full benefit.
Okay, so it's not just this one time. It's
not just one time. It does require some follow-up treatments. Typically, the typical person, 6 months after original treatment, needs about half the volume to get back to full correction because of the substitution of your own collagen for the bovine collagen, and then maybe another 6 months later, 10 to 20% volume to get back to full correction. So it is a project.
So, and that will increase the volume here, because I notice as I'm getting older that the my face is flattening out.
Yep, exactly. You know, and some people, you don't really have it, but some people even have like what's called a malar groove right here from that loss of volume as things drop down. But on both sides, we're going to restore this volume and do the same down here.
Okay.
Okay? Again, it's a very different technique from needle injections. I'm going to use numbing cream, but I'm just going to be putting the numbing cream in a couple tactical locations, the areas that we're actually going to be inserting the micro cannula. So instead of having numbing cream smeared all over, it'll just be in a couple localized areas. And the product filler we're going to be using today is Artefill, but micro cannulas can actually be used with any of the fillers. The difference is with micro cannulas, the tip is blunt, it's not sharp, and there are tiny holes on the side at the distal end of the needle, and that's where the product comes out. But because it's blunt, it doesn't go through the skin on its own. It needs to be, we need to puncture the skin with the needle, so there's a little bit of pain involved with that, but not bad. And then the real challenge with the micro cannula is to actually get it through that small little puncture hole that we make. Okay. And here we go. And feel a stick. Again, that was from the needle. And here's a small hole. And just make an insert. And now I'm under the skin. It should not be very painful. And I'll be injecting Artefill into this area we just talked about. So I'm going to be
I mean, I can't feel anything at all.
Yeah, and you've had needles before, so you know they're usually, even this area is not as painful as most, but you know from previous treatments that.
No, but I mean, I really have no pain at all. I don't know if it's maybe the numbing cream or the technique.
No, it's
There's
a technique.
Nothing.
Again, most of the nerves are in the dermis, and when we get subdermal and we're kind of pushing through and around nerves and arteries and veins instead of cutting through them, it just makes a dramatic difference. Much better. And you can see we're starting to get some volume. I've injected about half of the syringe into this area, and the idea is to rebuild this volume in your upper face.
But I'm amazed because I can't feel anything. I mean, there's no pain, nothing. I can't. It's amazing.
Oh, very good. And most fillers, including this one, are moldable. So after we inject them, we just kind of, and again, through this tiny hole, we've done that correction with no pain, and we place the Artefill in a subdermal location. Okay. What I'm going to do next is I'm going to move on to the lower face, and they're just a much more dense concentration of nerve endings down here. And the same idea, I'm going to basically use the same technique, in this case a 22 gauge needle, to make a little mini puncture. Puncture hole. Now I've inserted the cannula. I'm going to come down here and I'm going to treat this area. Now Artefill has lidocaine with it, intermixed with it. So usually after the first little bit, there's going to be some discomfort here. But this is an area that's notorious for bruising too because of the vasculature down here. And we've seen dramatically less bruising in patients we've treated with the Dermasculpt microcannula as opposed to traditional needle fillers. A little more work, and you can see it's not a straight shot. You have to be patient and kind of work your way into the areas you want to get to. And this cannula is also flexible. You can see me bending it here to get around turns, to get down into this area that I want to provide volume. How is that in terms of pain?
It's nothing. There's no pain.
That's great. Because again, this is an area that traditionally we'd be doing nerve blocks to even get near this area, but I'm pretty much done with this lip in an area that normally would require a lot more anesthesia. Okay, done with the lower lip. Now I'm just going to redirect a little bit of lidocaine. Okay. There we are. How is this compared to your previous treatments?
There's really no pain. I have a fear of pain, but I'm anticipating pain, but there is none, so it's more...
Again, the tip of my cannula is right here where I want to be, so I'm going to inject.
I can't even feel it.
And that is a remarkable thing. Any injector anyone who's had their lips injected knows that this is not a fun place to be. Okay, so we're done there. And again, not huge volume. We're just going for vermilion border augmentation. Finally, we're going to come up here. And again, do that same insertion site. And I'm up here. And again, it's nice too, because you pretty much know you're not going to be injecting whatever product you're using into an artery or a vein. It's just another added level of security and safety. So again, transformational technology, less pain, less bruising, not zero pain, but less for sure. What I'm going to do is I come back, okay, so now, are we done? You know what, that lower lip could use a little more volume. So I'm going to come back out. I've already been there. I'm going to go back through that same kind of little mini track that I was in. Here we are. And with this little bit that I have left in the syringe, I'm right back here. You can even go past the midline. I'm just going to deliver it right there and I'm done. We usually ask people after needle injections on a scale from 1 to 10, how was that? You know, and the typical answer is a 3 or 4. How would you say that was compared to?
There is honestly no pain at all. I mean, I know in other procedures it was very uncomfortable, but there is none, which I'm amazed at.
Yeah, I mean, it's remarkable.
Nothing.
Remarkable. Okay, good. So you can see what we've done so far. We've softened up this line. We've filled in some volume here. Okay.
Going to be is it going to stay that way or?
Yeah, it's going to stay that way. I mean, there's typically some tissue swelling, so it may back off a little bit over the next day or two. But Artefill, compared to other fillers, doesn't really produce a lot of tissue swelling. So, and gradually over the next 6 months, you'll lose some of this volume as your own collagen substitutes for the bovine collagen.
It's permanent?
Permanent in that, you know, when you're done at the end, it's still a project. It's not one treatment when you're done permanent, but it's a permanent filler in that when you're at the end of that project in a year and a half, then you don't have to keep doing it again and again, which is nice.
Wow, yeah.